We Say What They Can't Radio.
Hey everybody, how you doing? I am Tony.
And I'm Shama.
And I'm Monique.
And we are the Lipstick Chronicles. Thank you for tuning in. As usual, thank you for everybody that listened, shared, and subscribed our last episode or any episodes. So I guess we could introduce and then I'll go into the hot topic. Yeah, okay, so we have a special guest with us.
Hi, my name is Dr. Eugena Griffin.
And she will be here giving us a little, I guess, what are we going to talk about today?
We're going to be talking about mental health, in particular depression within our community.
Okay.
That's good. Okay.
Yes.
All right, so before we get into that, so we're going to do the hot topic. I mean, it's really not, it's really on a sad note. So as everybody should know by now, Kim Porter just passed away, Puff Daddy's baby mother. They said that she had pneumonia, but I think what really ultimately killed her was that they said she had a heart attack.
Yeah, she went into cardiac arrest.
Yeah, so, she was alone. She was 47 years of age, and it's just really, really sad and unfortunate. She leaves behind 4 children, 2 twin girls, and 2 sons. So definitely we want to send our condolences out to the family.
Yes. What the hell is
Yeah,
going on today?
today is just listen.
It's because we out of our zone, the time frame.
Yes.
Our time went back, so we all messed up.
Everybody all discombobulated. But anyway, so we'll start the show. So yes, so share.
All right, so I just wanted to say, when you talk about depression, you want to look at mental health and depression in particular from a multifaceted perspective. And what I mean by that is understanding the etiology of depression. What is depression and how does it originate? I think that many people are not cognizant that for some, depression is biochemical, so it's innate, it runs in families. Typically, when I ask people about their experiences, I always like to know how were their parents and possibly grandparents and siblings as well, because it gives an idea of whether or not depression runs in families versus their experience of depression being situational. I think it's also multifaceted in that being Black in America, I think we have race-related stressors that make many of us suffer from consistent or persistent sadness, which would also lead to depression. So when I talk about depression, I think it's important to note what are the symptoms, and looking at symptoms, realizing that for adults versus children, depression would look different. Sometimes the presentation of depression for men versus women would be different too. So a general overview of what depression is, you want to think of a persistent sadness, a lack of interest in typical activities or interests, typical interest in certain people, persistent isolation, change in appetite. For some, people may overeat, where you have your, I call them emotional eaters, and then you have some people who have a lack of appetite as well. You have those individuals who may have difficulty with eating. I mean, not eating, with sleeping, excuse me. So you have some people who will oversleep. You have those who would undersleep. You have some people who experience what many would say a hopelessness and despair as it relates to their present, but also their future. So they can't see any good, they can't see any value, they can't see any purpose in moving forward with life. With depression, or true depression, because you have some people who just are sad because of a situation, but you want to look at the chronicity or the chronic level of their sadness. Is it lasting for at minimum 2 weeks? And are you seeing the sadness across different contexts as well? And when we say context, we're talking about the home, school, work, and community. One thing that we don't talk enough about is how this sadness and lack of interest and despair or hopelessness could also be the foundation of suicidal ideation and suicidal tendencies. And in the late, I would say 5 to 10 years, we're starting to see an influx of suicidal ideation and even attempts that were unfortunately successful within our community and within our youth. If I'm not mistaken, I think just 2 or maybe a year and a half ago, we had a young fella, I believe down south, who hung himself while his mother was downstairs making breakfast. I don't know if you guys remember that, but part of what was reported was the etiology being he was being bullied at school. So when we talk about depression, again, I think it's important to look at what's going on that triggers this persistent sadness and really helping people navigate through that. I think oftentimes depression, regardless of whether it's biochemical or situational, it remains because people struggle with how to cope and how to navigate their challenges. And some of the work that I do with my clients is basically helping them to identify positive ways to cope with life stressors. At the end of the day, I think, again, being Black in America, all of us have some level of stress. But even for our other sisters and brothers of the other ethnic groups, part of dealing with depression is really to learn those coping strategies that would be more adaptive for the individual's age.
I have a question. Do you feel within our community, speaking of our community, the Black community, that we are less hesitant to seek help?
Yes. I think oftentimes because our history and culture promotes more of a spiritual flavor, being able to pray, not that we shouldn't. I'm a spiritual person as well, but I also think from a spiritual perspective that the Creator gives us those health professionals to help us. That's just like saying, if you have a chronic toothache, are you just going to pray over it? You need to go see the dentist.
Absolutely.
And just as if you feel anxious, if you feel a persistent sadness to the point where you're not doing what you should do, I think you are in need to talk to someone, or some of us need medication too, in addition to talking with someone.
Do you feel that once an individual begins to get medicated, is it something that will continue throughout their whole life, or it can vary?
I think it can vary, again, based on the etiology with as it relates to depression. For individuals who have mood variability that runs in families, so there's a imbalance in dopamine or serotonin within the brain, it's very possible. FDA does talk about medication management, but also titrating people off of medication, being on it for such a long time. I always like to tell people, when you take medication, oftentimes it treats one thing but would onset others. So I'm not necessarily eager to push people for medication, specifically for those who are diagnosed with depression. I think if you had something like a schizophrenia,
Yes, absolutely.
that's something that you will be on medication for your life to help you manage those delusions and other symptoms that come along with being diagnosed with schizophrenia. But for depression, sometimes people may need medication just to get them to a point mentally and emotionally to work through their challenges, and then they can titrate off. Okay. Sometimes people will need hospitalization because they have engaged in a few suicide attempts. Yeah. And I feel that in our communities, we take that light too. When people start talking about the idea of wanting to hurt themselves, that's not something that we should just sit at home and, again, just pray about. You do have psychologists within the community, including myself. You can always contact your insurance carrier. Some of us don't take insurance, some of us do. But I think that in emergency situations, people need to be hospitalized on top of psychotherapy.
I don't want to take over, but I got questions. Okay.
Ask as many as
No,
time
one thing
will
I
allow.
think that we all have an issue with is we don't like to acknowledge that something is wrong. So we just try to figure out a different way to just, I'll figure it out, or I'm just not going to talk to nobody for a while.
Because we don't want labels.
Because
Right.
when we was growing up, I feel like there was just people that just had issues, and they'd be like, "Oh, her little crazy self, this little crazy self, go sit your little crazy self down somewhere," like, and that was just the end of it. Or they'll just say, "Oh, they just a little slow," or and that's just that. Like, but there was no dealing with it. There was no talking about it. Just be quiet, and you're not going to embarrass the family and stuff like that. There was no go to the doctor. The only other person I think was go to the pastor, maybe. Outside of that, it was just go sit down somewhere and just cut it out.
I think that there's and this is not said to be derogatory, but I think that there's a level of ignorance within our community, a lack of knowledge as it relates to the benefits of mental health services. Mental health providers are trained to deal with mental health issues. My training included understanding mental health from a biopsychosocial model. No one else can do that. No one else has that training except for a psychologist. You may have other providers who may know a little bit, but I find in our communities there's always some type of negative label. We're so quick to minimize issues that can really take a person's life. Depression is a very dangerous thing.
Yeah.
It's dangerous to the point where people are killing themselves. I've had clients in the past who attempted suicide, jumped in the train tracks. And now, unfortunately, the individual just has one arm left. She's still living.
So now she got to live with that. Like, I tried to kill myself. I didn't kill
wouldn't want to
myself.
survive
Now
that.
I'm disabled.
But then you have to look on it as, of course you wouldn't want to go on throughout life losing, missing a limb or whatever. But I think too, when you sit back and come out of whatever situation that you were in at that time, you might be grateful that you didn't take your life. I know a young man that, he grew up on my block. He was really, a little bit younger or whatever. And I remember running into him. I haven't seen him for years. And, I think, hey, how you doing? And then I heard about 2-3 weeks later, he killed himself. He jumped on the, I think it was the Q or the B line, and he killed himself. And I was talking to a friend of mine, and I was saying, because the mother was trying to say, he had stresses going on. He was expecting a baby, and I guess, I don't know, whatever was going on between him and his child's mother played a part. But I said also maybe it could have been some mental health issues already pre-existing, but, the mother doesn't want to accept that.
Of course.
She's just like, no, it's because of this situation, it could have been something there, and it's sad because you never want to hear about somebody losing their life.
Absolutely not.
I wanted to ask you, do you think social media is helping or hurting people dealing with issues? Like, because they don't want to talk to somebody, but they could sit behind the phone or the computer and just make friends that they probably couldn't make if there was no social media. So that helps, or is it making it worse?
I don't see true benefits of learning how to deal with your specific life stressors via social media. I think that there are specific techniques that mental health providers use or should be using to help people navigate their stress. When people put stuff out on social media, it's for likes. It's not necessarily to teach me how to cope. And again, if people are truly experiencing chronic depression, in many ways, it's only a cry for help, and most people don't see it that way.
Right.
Absolutely.
It's like a temporary fix. Like, I'm sorry, I just don't want to talk too much.
It's all
Right, like with girls half naked and photos and posting and stuff like that.
A cry for attention, but also help. And in many ways, that's people acting up out of their depression and low self-esteem. I think people who really value themselves or respect their physical anatomy are very discreet about what they post.
Right.
And when people do the opposite from a mental health perspective, I always question the forwardness and the freeness of especially for a woman, being so free with her private,
What made you decide that this was the profession that you wanted to go into?
Oh, very nice. My college students ask me this a lot, and believe it or not, from small,
Okay.
I knew I wanted to be a scientist. You know, psychologist is a science, it's a behavioral science. And I never forget when my big sister, Kim,
Hey,
Gia,
Kim.
was going off for school. I remember reading one of her pamphlets about Morgan State University and looking through the degree programs, and they had a program about psychology. And the more I read, the more I realized that this is something that I'm doing already with my friends. My friends from elementary school to even present will call me and share some of their innate personal challenges, and we will problem solve and stuff like that. And I just realized that I think I have a niche for doing this. I like helping people help themselves, so that's the road that I went. The journey was not easy,
Of course.
becoming a black doctor in this racist country,
Yes.
but by the grace of God, here I am.
How long have you been doing this for?
I have been a doctor since 28. I am 20. I'm 39 now, so 11 years, 10 and a half years.
Okay, that's great. You
A
know,
long time.
yes.
So how
I
do the
think it's
patients feel that
beautiful.
are young, that are older, and they see you like, oh, you so young, like, how you gonna help me? Like,
I think when I used to work in hospital settings, they used to think maybe I was a trainee until they read my name tag on my white coat and it read Dr. Griffin. I would have to say, no, I'm the doctor. But the more you interact with your patients and you gain a level of respect for them, I think that people value your expertise and your passion for helping. So they overlook the baby face, you know, black don't crack.
right.
And so far, so good. I have patients as young as I think 15, and I have patients old enough to be my parent. So
And
far,
your
so
practice is in Brooklyn?
good. I am downtown Court Street.
Oh, you're in a
okay.
good location too.
Across the street from the
Access-
court building.
Yes, accessible by the bus and the trains, all of the number trains and the
Okay.
A. And
I think I
all
know
that.
what building you're in. I mean, you could give the address. I mean, you could let them know where you are if you want.
Exactly.
You know, so I think I know where you're at.
I have a question.
You've had the only questions.
Listen, I got a lot of questions. When you know, because you're a doctor and you deal with mental health, and when you listen to a lot of problems of other people, and you know you lose patients and things like that, how do you yourself deal with that?
That's a good question. Very good question. And I'm gonna be transparent because of the listeners, and it's
Right.
always a good way to be honest, so that way other people can learn. I worked in a hospital setting from 2010 to 2016, and I think I became emotionally drained. There was nothing for me to walk into a room and a patient was already dead. Substance abuse is not a good way of coping. Even though I like my Moscato,
Yes.
I wouldn't never like kill the bottle. For the most part, I have two other sisters that I graduated from USC with. They're doctors too. As far as I'm concerned, we're sisters for life. Dr. Johnson and Dr. Keisha Edwards, they're down south. I would call them and process things, so it's
Right.
not just on my shoulder.
that's good.
Sometimes I share with
You need
my,
an outlet too.
yeah, I share with my mom, Bobby. I'm gonna give her a shout
Hey,
out too, because
Mama.
she's supposed to be listening. I have a very supportive network.
That's
I have my best friend Adrian. We've been friends since we're 11 years old, and we pray together every Wednesday. I have a strong spiritual life too, so I sing and lead praise and worship,
So that definitely
participate.
helps. That definitely helps.
Yeah, I went to church this morning, got my
All
word
right.
and
Okay.
stuff like
That's
that.
good,
So
yes.
I find positive things to do. I also can participate in different bike tours. I do a lot of the bike tours that you would see in our state. And I started kickboxing.
Ooh,
very
how
good.
how's that?
Oh, it's intense. I don't like it, but
You don't like it?
no, but it really is a stress relief.
I wanted to do something like that, like
It's
boxing
It's
or
a
something.
nice total body fitness. Keep, all of our assets in order.
Yes.
Yes, you have to. You can't forget about that.
Let me ask you a question. What do you think about, it seems like this is something new over the last couple of years, life coaches. What do you think about somebody that needs help with issues like depression and stuff like that, and them going to a life coach versus going to a doctor?
I'm not going to minimize my profession, so I think that something as severe and chronic and dangerous as depression, you need to go see a psych professional. To me, a life coach, and no disrespect to their profession, is someone who's going to help an individual kind of navigate maybe a vocational issue or something like that. When you're talking about depression, which can, again, lead to hospitalization, suicide, just people not living a healthy life, you need to come to the professional who is trained to deal with that. That's like saying my heart hurt, but I'm going to go to the pastor so he can pray. Not minimizing spirituality, but you need to go to the right channel to get your needs met in that particular instance.
Right.
Absolutely. When we talk about depression and things like that, like how hard is it to deal? Because you deal with kids as well. Is the youngest 15, or do you have any clients that are younger than that?
Well, I do have some new ones coming into my office this week that are younger. Mm-hmm.
How hard is it to deal with a child versus dealing with an adult?
I think I'm sensitive to children.
Yeah.
I love children. I think some of them have some very interesting cases. Over the years, now mind you, I started my doctoral program at 22, so I've seen young people in partial hospital programs who have already tried to commit suicide at 10 years old. I remember those things, and it's heartbreaking. And to have to make the decision to put them in a hospital versus allowing them to go back home, it's very saddening. Our young people have their whole life ahead of them, and it's very sad to hear some of the reasons why they're sad. I think many of our young people, because we live in a society now where everything is so immediate, a lot of them are not learning how to navigate life, and that's why they're sad. So it's not even, I'm sad because they're sad. I'm sad because they're not learning the strategies as to how to develop healthy coping mechanisms early on. They're sad because of material things. Some of the ones that I see are not necessarily sad because they're being bullied or they're being victimized at home. I've seen that before.
Yes.
In partial hospital programs, working with young people who have been raped, working with young people who have been a ward of the state and their parents don't want them. That stuff will make you,
that's heavy. That's a lot.
want to just give them hugs even though you're not supposed to. Right. You don't want to start hugging on your clients because you don't want people to say that.
You can give them mixed signals and stuff like that.
I don't want nobody accusing me of no sexual
That's right.
harassment.
That's
So
right.
I don't hug children, and it's rare that I hug my adult clients because you don't want to give mixed messages. But working with children who had those, I won't say true depressing instances, but instances where they've been victimized or something like that, it is very saddening.
But how do you handle if your patient is a child, and a big part of their problem is they get all of this help from you, but none at home? So you do all this work, and then they go back to poor parenting, and how does that help them when they go home? Or do you have to include the parents in this?
Once you realize, part of what we do is a lot of evaluation. So you don't just talk to people and start trying to help them figure it out. You have to, I always say, being a psychologist is like being a detective. You have to really help people get to the root or the inner core of what's going on. And when you realize that it may be a family issue or an environmental issue, you definitely want to create an intervention that's going to address the environment. So if that means addressing the parents and stuff like that, they will have to participate in some type of family meeting to communicate what I'm seeing and hearing.
What are some of the signs you look for for depression in children?
Irritability, non-compliance, a lot of lack of interest in preferred activities,
Okay.
a little bit of aggression as well,
Okay.
isolation.
So if you notice that a child has those things, and say a parent does bring a child in, to speak with you, like how, I know it's not a process that you can really put a time frame on, but like how hard is it to actually get the child to really open up, I guess case by case?
It is case by case. I have some young people who talk.
Okay.
I do. And they come to me and share everything.
They've been waiting for someone to
They
release too.
just like have diarrhea of the mouth. They share just everything.
Wow.
Well, that's good.
It is, because they're ready to work. But then you have those who are not what we would call, especially your teenagers, they're not introspective yet and not necessarily able to communicate or pinpoint what the issue is. So you get a lot of I don't knows, and sometimes that can be frustrating and a little annoying because you wanna help people, but sometimes I find some young people are just really not ready to work through their issues. So it takes some time.
Well, how long do you treat a person before you feel like, you know what, I'm not breaking through, and this is not going anywhere, they just not ready?
Since I've been in my private practice now, going on 3 years, I haven't had a client where I stopped services. Because, again, part of being a psychologist is being a detective, but also being creative to connect with your client, to reassure them that you're here to help them help themselves. And you're constantly figuring out new ways to help them uncover what the issue is. When I was working in the hospital, that was a little different. There were times where I would just say you have some people who are just too stubborn, or again, they're not introspective enough, where I would just, tell the hospital they're not ready. I'll come back in maybe 3 months.
When it comes to substance abuse, is it really common that people who have abused drugs usually have onset like mental health issues as well?
That's a good question. People who use substances, do they have mental health issues as well? I would say yes. And the reason I say yes is, I say yes partly.
Okay.
Partly because some people don't realize when we ingest substances what it alters in our brain anatomy. Some of us, I like my Moscato, right? But it's a difference between just having a social drink to actually using a substance as a way of coping with life stressor.
Yes.
When you start to that point of abusing a substance, and when we talk about abuse, now the substance is impacting what you need to do from day to day or putting you and others at risk, then yes, that is a mental health problem. Whether it's alcohol or marijuana or other things that people may use, definitely mental health problems.
Wow. Is there any type of advice that you would want to give people that are suffering with depression and are really reluctant to seek help or, anything like that? Is there anything that
The first thing I would say and I actually told this to a young lady last week. Part of taking care of ourselves is realizing that we have to stop, in many ways, caring about what other people think. This label of, oh, you must be crazy, or something's wrong. I think something is more wrong if you continue to allow yourself to go through your challenges versus not seeking people to help you. But the other thing I would say, look past the label, but really find someone who you could trust, build a relationship with, and allow them to help you navigate through your challenges. I think you can look through your insurance carrier, you can use Psychology Today, where I'm listed, and other networks to find a good mental health professional. But I think allowing sadness and a lack of just living, life is so beautiful. Even in the midst of the unfortunate structures that as people of color we have to endure, life can still be great, and I think that people need to find the resources to help them navigate through whatever it is. And if not, you're going to have an increase in people killing themselves, which is very dangerous.
Yes.
It is.
And sad.
It is sad because then you have those people, and if they're not trying to kill themselves, they're trying to kill other people. Like, that's why we have a lot of these mass shootings and things like that, because a lot of these individuals are not mentally stable, and they did not, either they didn't seek the help that they needed, or those around them that knew something was going on with them didn't try to take the time to encourage
Totally
them.
ignoring it.
Absolutely.
And so that's a major issue, and it's really, really sad because there's an increase of these mass shootings. It's like every time you turn around now, you hear there was a mass shooting in Florida. There was a mass shooting. Like, I think it's just insane.
I agree.
And there's always somebody, I think, that knew something
course.
was going on with
Of
that
course.
person. There's always somebody. They
course.
couldn't have been alone in this world, and nobody knew that they had the potential to do something
Their
like
parents
that.
knew.
Yeah,
Somebody
they-
knew.
Yeah, but they, for some people, I think it's really easier for them to ignore,
Right.
to do. Especially when you're not in a position where you're accepting what's going on with, say, your child or your mate. Like, no one wants to think that their child or their mate has any type of mental health issues, so then they just ignore the signs, or, oh, it'll get better.
They'll grow out of it.
And it's like, no, it doesn't get better, it only gets worse.
Absolutely.
Especially if they're like, everything is just being built up
Built up.
inside.
Like,
It's
that's
just
not
constant.
healthy.
So if one thing is bothering them, and then they deal with that on their own, and then now it's just stuff piling up and piling up and piling up. Eventually, it's gonna blow.
Absolutely.
Yes, I mean,
And you gotta stop being so quick to give out medicine for everything.
Oh God.
There's a medicine for everything. I got a prescription for foot pain. I have a heel spur that just won't go away. I wanted something for the pain, something a little stronger than Aleve or something like that, or whatever. And the doctor, he quick, like, I just told him what was bothering me, like, it's my whole heel. I don't know what to do. He gave me a prescription, and I look up everything. I need to know. This thing had more warnings to give me a deeper issue than it would to fix the heel spur, including if you have depression. This medicine will more than likely make you a little bit more depressed. I'm like, so my heel spur won't go away, but I might go to work and kill everybody.
Right.
So I don't know. And I remember going to the emergency room a long time ago when I had a cold, and I just felt like, you know what, I don't want to wait for a doctor's appointment. I should have, but I was like, I'm going to go to the emergency room. He gave me Percocet. I'm like, I have a cold. So I'm confused, but just like that.
That was for the pain in your foot.
but pharmaceutical companies is a
Exactly.
multi-billion-dollar business. You have
Yes.
so many people that are addicted to pills.
Yeah. You see that now they're doing the opioid, this whole campaign about opioids, because now the other people are really
Yeah, because
getting,
they're really
stressed out, addicted to
They're
it.
addicted to it, but then it's also spilling over into our community because you
But we don't talk
have-
about it, so we
Yeah,
don't know.
Well, no, that because they are talking about it. They're talking about it in the music and
But
things
it's
like
like
that.
it's
They're
okay.
making it
It's like okay.
Like
Right.
and when we were growing up, people talking about 40s, smoking weed. Now they're talking about drinking lean, taking perks, like
Right,
it's a
popping
totally-
Molly and all this other stuff.
It's just totally different. And so pills has just become the new thing that everybody is doing. And
I
it's
think
just,
most people want a quick fix to
Yes.
Yes.
a issue that's going to take some work,
Yeah.
and that's all it is.
Right. So if you high, how can
It
you
goes
be all
away.
sad?
It
Like,
goes away.
I'm so high, I don't even know
Yeah.
what was my problem.
I
Like,
think that's
Like
very
if you go to
dangerous.
sleep, you don't know what's going on. So
Right.
if you high all the time, you just numb to everything. So you just feel like your problems are gone.
But then for me, I feel like that's a yes and a no, because sometimes when you self-medicate, it intensifies
Yes.
some things that are going on. Like, you do have those that are, they're okay in the moment. They're not really thinking about things. But then you have those that it just brings everything to surface. So it's just,
Yeah.
Very dangerous. And
It is.
Yeah.
that can definitely make somebody go over the top and off a bridge.
Right.
So,
Yeah. It's kind of crazy.
so is that like a last resort to prescribe medication?
I think I'm gonna go back to what I said earlier. If it's a chemical imbalance, I'm not gonna say no to medication, but I would say no if all the individual is gonna do is take medication. To me, you have to, if you're gonna do medication, then you have to be willing and mentally able to work through your issue. And for depression, I think that for some, maybe they do. They can benefit from a low dose of an antidepressant. And then you have those who they look at medication as just, again, a quick fix, and I'm not a fan of that.
right.
Especially those who are already talking about suicide and stuff like that. I think you need to get them to a different, a safe space first before you give them a prescription. It's
Well, I mean, I
dangerous.
think people would be grateful to see a face that looks like theirs.
Right.
It'll push them more, I think, to want to talk to you
Right.
because you look like me. So more than likely, they figure you might understand what I'm talking about. Like you get
I
it.
tried.
You're right. I think they'll feel like you get it
Yeah,
because you come from what they come from, and that I think that will get people to reach out. Like, yeah, you from Brooklyn, right?
Yeah.
Right. Like,
I grew up in East New York.
oh, East New York. Okay. Like, how can you not feel comfortable
Right.
talking to somebody that comes from where you come from?
But you know what I noticed too, in being a black provider, especially when you said being young earlier, I will say this: some of us, and I think in some ways, some of the parents that I know come across like this. I almost find that we're so internally oppressed that we can't even see value in our own doctors. So we rather go to white
That's right.
doctors and think that they have the truth.
me.
They're better.
And to me, I went to a Ivy League institution. USC ranks one of the top 60 schools that produce doctors in this state. I mean, in this country, and it's just really saddening that people don't value what you say sometimes, and I almost feel like I have to fight sometimes with parents to follow what I'm suggesting. I went to school for this. I didn't
Right.
read it in a book, and now I'm just trying to charge you money to
Use
come.
you as a guinea pig
Right.
to just do whatever.
I'm not doing that. I went to school for 12 long years to study to be a doctor. I know what the heck I'm talking about. And I think, again, some of us are just so internally oppressed. If a white man ain't say it, then your black doctor ain't saying nothing either.
And I think
And
totally
it's very,
different.
very disappointing. I'm glad you do. But in my profession, and it's the other thing too, some of us, we know we need help. We'll spend $500 on them shoes. We'll spend another $300 on our hair, and just all different types of money on material things. But when it comes to your mental health, when I tell them my fee, $125, which is not that bad.
That's not.
For me to get my mind right, like
That's
that.
not.
It's not that bad.
Right.
I'm asking you to pay me something, right?
Right.
I'm not asking for $1,000 a session.
Right.
But $125, and you got some people who say, "Oh, I can't do that." Yes, you can. Black people are
But
so
they
quick.
wouldn't say that too. Oh wait, doctor.
They sure enough would
No,
not.
they would
We
not
are
say
so
that.
quick to say what we can't do to support our own in helping us help ourselves. But if a white man charged $250, some of them be the first ones out there paying that $250 to get their mind right, and it's sad.
It is sad.
It is.
I mean, just speaking on that, for me personally, why I feel the way I feel, because I feel like, especially when it just comes to something as fragile as your mind, and first of all, you're a black woman, you're a black female, we're around the same age, you can identify with it better than another race can. Like, I don't care, I can sit in their chair and talk to them for days and days upon, and they will never be able to fully understand the pitfalls of just being a black woman. So for me, I would prefer to see somebody and talk to somebody that looks just like me.
Because when they're dealing with you in a general state.
Right.
Not to get too personal, but never could be on a personal level in any form.
Absolutely. Listen,
I agree.
everybody trust level is totally different.
Exactly. And sometimes you when you go to the counterpart, you feel like you're being judged.
Oh,
So it's like you could talk to someone as yourself and you could feel like I could relate to her. Like she could probably relate to me.
Right.
So
I think too, with all of the racial attention in this country and our history in this country, I think that we should just be careful to support doctors who look like us. And I'm not trying to minimize, again, other race groups and their professions and stuff like that. But many of us as black doctors across different disciplines, we've worked hard to come back to service our own communities. And it's almost like a kick in the stomach when you tell people this is what it is. And I'm not backing down from that. If you don't want to do it, then God bless you, But I just find that some of us are so, again, internally oppressed that you have great talent, great doctors in our communities and accessible to us, and we're just overlooking them because we'd rather go to white people and...
Is it very discouraging?
I think that now that I'm going to be 40 next year.
now that you're in there deep.
Yeah, I stopped, and I'm going to say this really freely. I hope y'all don't mind, but I don't give two hot shits.
That's right.
Okay.
That's right.
Oh no, we definitely don't mind up in here.
Because at the end of the day, I would say in my 20s.
Yeah.
I was still growing.
Yeah.
My early 30s, but I'm 39 now. I don't give two hot shits if you don't want to come.
That's right.
You just
It's
making
okay.
room for somebody else who wants to be serious about their health.
Exactly.
Yes.
And at the end of the day, I'm a full-time academic, so
Okay,
you're
so-
not making me lose money.
She still gonna get her coins.
Exactly.
I have books out there. I'm always speaking at engagements. My private practice is running fine. For those who want to come, let them come. But if you don't want to put the work in, don't waste my time. I'm very
Exactly.
serious about my profession. I'm very serious about being a person of resource for our community. And if you don't want to do work, don't waste an hour of my time
Exactly.
fooling around. Because it's not about money. It's about really being in service. I'm not broke.
Okay.
No, that's right.
Okay.
It was something I wanted to ask you. I'm trying to
hurry
remember.
up.
No, I can't. It's gone. Sometimes it goes. I guess it wasn't meant for me to
Do you
ask.
take urgent calls? Like, I'm having a crisis tonight. I need help.
If it's a client of mine that I'm already seeing, I will keep my phone on and accessible.
Okay. Well, that's good. Because sometimes some people have a today wasn't a good day.
Right.
And I don't know. And
Right.
either I'm going to turn this bottle all the way up to my head or I'm going to call Dr. Griffin.
Yeah, I would rather them call me. I do send text messages to my clients just to kind of check in when I haven't seen
that's
them
cool.
in a while. I have one in particular who's, they're all dear to me, but you sometimes connect with people on a deeper level.
Yeah.
She's been out. She had a foot surgery, and I felt she's like a sister, even though she's my client. So I've been reaching out to her and stuff like that via text, just to say, you know, I'm still here. I'm thinking about you, and pray everything that's, you know, is going well with your surgery and stuff like that.
It's funny that you said that because we don't do enough of that for each other, you know, and that's a major problem. Like, we might not speak to somebody for months or whatever, and this is like, oh, whatever, when I get around to it, I get around to it, and not knowing that sometimes people are going through some things and they need a familiar face or a person just to pick up the phone. Hey, how you doing? Are you okay? Just real simple. It doesn't have to be long, drawn out. Just, you know, just to check in. Like, we don't do enough for that.
That just happened to me the other day, Friday morning. I was thinking about my friend. I don't talk to her that often, but when we do, we have a long talk where we catching up on everything. It's one of those. And so it was Friday morning before I left for work. I was like, I'm going to send her a message. I could have texted her, but for some reason I went to Facebook to go send her a message. And when I went to her page, I saw an obituary picture.
Jesus.
And I was looking like, what is this picture? And I scrolled some more. I'm like, why are these pictures like this one? Why do you... And I'm looking like, let me open it. Is this like a stupid party flyer or something people being... I'm looking, I'm like, sunrise, sunset. I'm like, she died on November 2nd and I didn't even know. Her funeral was the day before, I didn't even know. And I'm just like,
Wow.
the only mutual friend we had isn't on social media.
Wow.
So I don't even know if she knows. Like, I was just standing there staring at my phone like, I felt so bad. Like, I didn't know. Like, I don't know what happened to her. I don't know nothing. All I know is that her funeral was the day before. It was a short service, like viewing for 1 hour, funeral next hour, straight to the cemetery. That's it. I'm like,
Wow.
I didn't even know what to say. And I'm like, I invited her to my house to come to my get-together. That was on November 2nd.
No,
wow.
November 3rd.
It was on the Saturday.
It was the 3rd. 'Cause no, my party was supposed to be on the 3rd. It was the 3rd.
Well, whatever that Saturday was.
Okay.
And I was confused, like, I should have reached out to... Then I started feeling bad, like, I hope that she didn't do nothing to herself. Like,
Right.
damn, I didn't reach out to her. Like, then I was just all in my feelings all Friday, all Saturday. Like, why wasn't I reaching out to her? Was something wrong and I didn't know? She was posting all the time on social media. She posted the day before she died. Like,
Wow.
it didn't look like nothing was wrong. Like, now I'm, like, overthinking everything. Like, how did I miss that? Like, did I miss something? Like, now I feel bad that I don't reach out. But it's like, it's but so much time in a day. Like, how many people can you reach out to every day? And then still, like,
Get your own stuff done.
take a minute to yourself and have some me time.
I think one of the things that I started saying in my 30s is time is the greatest gift that you can give anyone, you know? And sometimes a simple text message, I'll send out a group text to my close girlfriends, Adrienne, Kenyon, Keisha, Macy, and I'll just say, you know what, I'm grateful for you guys being in my life. We've been friends since we're kids till now in our 30s. And that's it. I'll do it, you know, like when I'm heading into work on the train or something like that. Time is the greatest gift, and we never know what other people are going through. I think as a community of people, of brown people, we have become so individualistic as our Caucasian counterparts because of our history of slavery to present. You know, we don't necessarily think about each other the way we used to. We're not as communal as we used to be. And part of it, we need to get back to it.
Totally agree.
Yeah, I gotta learn to reach out to people that I don't see on a regular. Like, sometimes you just
There's
out of
some
sight, out of
facts.
mind. Like, I didn't see him in like forever. I don't want to wait till it's your birthday. You just reminded me of Facebook. Gotta remind me of most people's birthdays these
Right.
days. Excuse my memory, but I mean, like, that helps me stay in a little bit of a loop. But it's like, I gotta do better than just social media contact with people. Like, because I hit you up on there, I'm not gonna do but so much but hit the like button or, you know, laugh a little LOL or something, but we really not talking.
Connected.
I don't know really what's going on with you, because you could be smiling in that picture, but really you sitting in your house and you just not good, and nobody knew, because they going by what they see
Absolutely.
that you post for the world to see.
Absolutely.
So we gotta do better with reaching out to people that we don't see on a regular.
Right.
Before we wrap up the show, you know, for our listeners, would you like to let them know, like, where they can find you if they want to contact you for services, things of that nature?
Sure.
Yes.
I can be reached if you're serious about mental health services. I can be reached at 718-802-8965. My website is www.tx4creatingchange.com. You can also fill out an appointment, interest or request via there. Or you can follow me at Instagram at creatingchange4others. Follow, reach out.
You mentioned another website that you were listed on.
Oh, my Twitter.
No. Like how they have when you can make doctor's appointments.
Oh, Psychology Today.
Okay.
Okay. Well, we just want to say thank you so much.
Thank you so
Thank you for
much.
coming and dropping those
Thank you.
jewels.
Thank you.
I appreciate the
I
opportunity.
apologize,
Yes.
but I couldn't. I'm usually the most talkative one. I couldn't really talk today because I ain't got no voice.
Thank you.
Yeah, so, all right, until next time, everybody.
Peace.
All right. Bye.